weight of the whole body. And all those calcium that is needed for the fetus are coming or withdrawal from the mom's reserve. What are the mom's reserve of this calcium? There are intrinsic source, means inner side from the mom, and the dietary source. We need to understand, okay, you're going to remind me this 3 and 4, because I need to understand the calcium metabolism and the role of parathyroid is very important. Calcium sources. Calcium source from the self body, from the reserve, cell body reserve, and the dietary source. Cell body reserves, where are the reserves? In the bone, cartilage, and intracellular, then extracellular, means blood, and the dietary source, you understand, the milk, milk product, egg, liver, etc. Okay, and vegetables, and small fishes. Okay, this is the dietary source. So now our body calcium is, say, 9 to 11 milligram per deciliter, and this calcium can go up, can go down, but body says I want to maintain the normal range, because if the calcium goes down, calcium has a major role for the muscle contraction, and every skeletal muscle has a circulatory system for the calcium movement, and this calcium, intracellular calcium, has a very good connection with the extracellular calcium. So calcium can remain in the blood, active form and inactive form. When the body needs more calcium, the cell needs more calcium, so it will be exchanged from blood calcium into the cell, or when the blood needs more calcium, it will be withdrawn from the cell into the blood. That's the way they maintain the calcium. If I have low calcium, my muscles are fatigued, very weak. Muscle contraction is very poor. So now, dietary source, the reserve is bone, cartilage, inner cell, extracellular, okay, and you can say teeth. And the dietary source, yes, milk and milk product, eggs, liver, vegetable, small fishes. So these are the dietary source. And it acts as a dietary supplement. If you want to go to the pharmacy, you can get the all forms of calcium with vitamin 1, vitamin D1, vitamin D2, vitamin D3. Then why I'm talking about the vitamin D? I'm going to discuss those things. So now, dietary source is very important. We need to have the healthy diet. Even your children, they need vitamin D. They need vitamin D. Okay, they need vitamin D for the calcium metabolism, for the utilization of the calcium. That's why you have to be careful what you are feeding, what product. Are the supplements are enough for the baby's growth and development. So now, in this dietary, say calcium you are eating with the food. So this is food. That food goes into the stomach, right? From the stomach, then after digestion, then needs absorption in the small intestine. And intestine will determine how much calcium needs to be absorbed. It's very interesting. It doesn't mean that I am drinking glass full of calcium and my body will be flooded with calcium. No, no, no. It will, all minerals in our body absorbed from the intestine based on the daily requirements. I will expend my expenditure every month or every day based on my income. That's the way it works. Then what's going to happen? The rest of the extra or excess amount of calcium, it will be excreted with stool. Stool. So that's why all those supplements you see in the market, in the pharmacy, they are all written. It is 10%, 15%, 20%, 30% of your daily requirements based on your age and BMI, body mass index. So if you eat more, it doesn't mean that I am having more storage of that mineral. No, it will be excreted out. So now, question. Calcium. Calcium metabolism needs vitamin D, and calcium metabolism needs parathyroid hormone PTH, and calcium, not vitamin B, vitamin D, calcium, vitamin D, parathyroid hormone, and another hormone that is called as calcitonin. Calcitonin comes from thyroid gland. There is a parafollicular cells in the thyroid gland, they produce calcitonin. So now understand, calcitonin, why its name is calcitonin? Because it works on the calcium metabolism. And vitamin D, there is a vitamin D1, vitamin D2, vitamin D3. And you will be surprised that our skin produces vitamin D with the help of sunlight. But unfortunately, our kids are getting even not only kids, we are getting less chance to have the sunbath. We all the time, in the morning, we enter into the transportations and we go into the job within the room, in the building, where there is no sunlight. And when we come home, there is no sun, and at night time we reach home and there is no sun. So we are getting less exposure to the sunlight. That's why most of the people, you will see 80% people, those who are immigrant in this country, they are doing hard work. They don't have chance to go to sea beach or playing ground with the sunlight. So they are lacking of vitamin D. And if vitamin D is lacking, the calcium metabolism is lacking. When the calcium metabolism is lacking, so our bones growth and development, cartilage bones growth and development, teeth growth and development is like a malnutrition. That's why they get easily fracture of the calcium, fracture of the bones. They may not get development of the normal healthy bones in the fetus or after birth. So now parathyroid hormone, calcitonin, these two are coming. This is from parathyroid, this is from thyroid. And vitamin D is mostly it is dietary source. And our body produce final vitamin D, but it has a stages. Some vitamin D is produced in the kidney, some vitamin D produced in the liver, then some vitamins D produced in the skin with the sunlight. So that's why vitamin D can go up, can go down, depends on the factor. Calcitonin is a negative feedback. It is controlled by the negative feedback by the pituitary gland and the thyroid gland. Parathyroid hormone can go up, can go down by the negative feedback mechanism. It is controlled by the hypothalamus, then pituitary gland, and then parathyroid gland. Just same as the thyroid functions, how they are controlled by the negative feedback mechanism. They all are busy to balance the calcium. So now tell me, if there is a decreased production of the parathyroid hormone, so then it will affect the calcium metabolism. If there is an increased number of parathyroid hormone, which is, if it is a 10-fold increase, 10 times increase is a very bad sign. It indicates the parathyroid gland cancer. If there's a parathyroid gland is very high, so then cancer is suspected. So then you might see the calcium level is very high. So when the calcium level is very high in the body, then what happens in our body? The calcium can be deposited in certain area, like a kidney, gallstones, any gland, exocrine gland, pancreas, then parotid gland here, and then lot of area. Even though calcium could be deposited in the muscle called myocalcinosis, medullary sponge disease of the kidney, those are calcium depositions. So calcium can be deposited any places. An extra amount of calcium deposited in the body, even the calcium can be deposited in the brain, anywhere. So then what going to happen? The structure cannot work properly. Parathyroid gland, it does not bother us, but when it is in danger, it is producing disease, then we have to look for the calcium, look for the vitamin D, look for the calcitonin too. So that's why calcium is very important, and without calcium normal range, our body response is different. With the low calcium is very fatigued we are. High calcium is suspected for tumor in the glands. Okay, I hope you understood, right? Good. So now we're gonna go with the what are the laboratory tests we need to see in the patient's file before scanning the thyroid and parathyroid gland, especially the parathyroid gland that we are dealing now. So we need to do the blood work. Laboratory test. So we do PTH, parathyroid hormone level. We do, calcium level. These are the two important things. Calcium comes automatically in the routine exam. Routine blood test, calcium is written in the report. And parathyroid hormone, we need to specify in the requisition that we need calcium channel. Then question, why we need to check the parathyroid hormone? Because the patient's chief complaint. What is the chief complaints? That a doctor will suspect that parathyroid gland may have a problem. So what is this? Patient will say, I have neck swelling. Patient will, same indication for the thyroid gland would be the same. Patient chief complaint, neck swelling for 1 month, and it is painful, and our body, my calcium level in the blood report, calcium point high. Then with this, the doctor will suspect why calcium is too high, and patient has neck swelling. We don't know what is coming from, and it is painful. Painful on touch, painful on swallowing. Why? Because it is pushing the thyroid gland, and thyroid gland is in danger too. Okay, so now when it is happening, then they will order for, so they will ultrasonography. They will order for ultrasonography. Why they will not give a nuclear medicine test, CT, X-ray? Because those are radiation. Thyroid is not a good organ for radiation. So they will order the ultrasonography to rule out, is it thyroid or parathyroid gland pathology. How they're going to know this is thyroid gland pathology? Not thyroid gland pathology. They will see the thyroid gland all over, echogenicity, the echo texture, vascularity. They are beautiful. And how they're going to know that this is a parathyroid gland pathology? By the location, displacement of the thyroid gland, and if there is a pathology in the parathyroid gland, it is always darker than thyroid gland. And parathyroid gland has its own capsule. You can easily see that it is not within the thyroid gland. So it is more hypoechoic than the thyroid gland, and it causes displacement of the thyroid gland anteriorly. Okay, now I will discuss about the sonographic technique. There is no specific protocol for the parathyroid gland. Then what is the protocol? Protocol is the ultrasonography of the thyroid gland. Ultrasonography of the thyroid gland, because parathyroid gland is attached with the thyroid gland. As I discussed with the anatomy, where is it located? So, protocol technique. No special protocol, for parathyroid gland. Parathyroid gland is virtually, it's not more than a button, size of a button. Okay? Now, Hyoid Protocol is observed. So in Thyroid Protocol, I gave you before the Thyroid Protocol, we need to see the thyroid gland in SAS and in transverse. We need to see the both thyroid gland in one view, in transverse view, along with the isthmus. Make sure what are the sonographic appearance we need to see. Okay, Thyroid Protocol is observed, so we'll do. So now we need to do the sono appearance. We need to evaluation of the sono appearance. Sono appearance evaluation. We need to see the sono appearance evaluation of the thyroid gland with the normal and with any abnormal with the location. Keep that in mind. We need to see all the characteristics that I'm going to write down of the thyroid gland. And there is a specific location of the thyroid gland. If you see something wrong, some tumor, then you have to make an idea, okay, it could be parathyroid, because the parathyroid hormone level is up, calcium level is up too. And patient has a complaint of the neck swelling with the painful for 1 month. So, sonographic evaluation of thyroid gland we need to see. So now, let me draw here. So this is a thyroid gland. You saw a mass in the thyroid gland in here. It is SAS view or transverse view? SAS. So this is a SAS view. Just understand this concept. It's going to help you a lot. So this is a nodule. This is SAS view. So this is anterior, this is posterior. This is superior and this is inferior. Where is it located? Anterosuperior. Right? This is anterosuperior. But at the same time, if you see a mass in here, and it is more darker. And it has its own capsule and isolated from the thyroid gland. What are you going to think? It is separated from thyroid gland. Where is it located? It is located posteriorly. And more darker than thyroid gland. More darker than thyroid gland. And it is pushing the thyroid gland anteriorly. Look. So based on the location, based on the sonographic appearance, I can say it looks like parathyroid gland. So if it is enlarged more than 1 centimeter, they will ask for fine needle aspiration, FNA. Fine needle aspiration to confirm this is parathyroid and the pathology is parathyroid tumor. Parathyroid tumor. So this is important. But the way it is located, it is very hard to get the tissue from the parathyroid in one shot, one set. So they might need multiple sets. So now, what are the sono appearance we need to see? We need to see the location, shape and size, then number, how many pathologies are there, then echogenicity, then homo versus hetero, then we need to see the texture. It could be coarse in texture and smooth texture. Then we need to see the vascularity. Then we need to see any calcifications. Necrosis. Shadowing. Enhancement. Okay, we need to see also the borders, contours. Okay, we need to see all those, we need to evaluate all those conditions. Okay, so then once the pathology is seen, comes with the blood report, is suspicious, so they're going to do the biopsy. Okay, so biopsy is the final investigation for final diagnosis. If it is a benign, treatment line of treatment is different. If it is a malignant, line of treatment is different. If it is a malignant, then it will show the malignant characteristics of the sono appearance.